Welcome to Brockley News, the programme where we keep you updated on all you need to know about what's going on in and around the hospital. I'm Ron Laver, and this coming Thursday the 5th of May has been named Hand Hygiene Day by the World Health Organisation, and I'll be talking to two of our infection control nurses about how the RNOH will be marking the day. Later, Sue Weston will be talking to Ronit Broder in the latest of our series on the TDF therapies. Then at 7:30 it's Bedside Bingo with our very own voice of the balls, Dave Rauch, which is followed at 8 p.m. by your requests. So stay tuned to Radio Brockley, London's longest running hospital radio station, and this year voted Best Hospital Radio Service by the Hospital Broadcasting Association. We are the UK's number one. So, on Thursday the 5th of May, the World Health Organisation are hoping to raise awareness of the importance of hand hygiene. But as we hear now, the RNOH is planning a whole week of events around the subject. This coming week is International Hygiene Week, and in the studio with me today I've got two of the nurses from Infection Control, Mojisola Adeyemi and Cristina Cimpeanu. Muji is the lead infection control nurse and Cristina is surveillance nurse. Muji, perhaps first of all you could tell me what the job of infection control is within the hospital.
Yes, the Infection Control Department is well embedded within the Trust, the Royal National Orthopaedic Hospital, and the whole approach is to make sure that we are preventing possible infections to our patients who come into our care. And also, if we have patients with existing infections, that will minimize the impact of that does not spread to other patients in the hospital or staff. And it works both ways. It's from patient to staff or from staff to patient. So we work with all clinical staffs and non-clinical staffs all through the patient's journey to make sure that we are preventing infection and we are controlling existing infections. As we all know that infection can be quite an issue, and it's not a nice experience to come into hospital and for a procedure and end up with an infection, because that could cause extra delay, extra length of stay in the hospital, pain, distress for the family, and it's not a good thing on the clinical staffs as well, because we care for the patients. The aim is not to harm them.
And Cristina, what's a surveillance nurse?
At the Royal National Orthopaedic Hospital, there is a surveillance service in place through which try to collect data, to analyze data and disseminate data about our patients. Surveillance is very, very important because we try to increase patients' experience during hospital stay, and we try to cut down the length of stay because during an infection, patient can get pain, can get distress, and along with the patient, family as well. So we do try to improve patient experience, and patient care and safety. It's very important.
Is that just about keeping an eye on the patients themselves, which is clearly a major part of what you're doing? Is there an element of you keeping an eye on general cleanliness around the wards? Is that part of your job?
Yes, it is. Infection control is quite broad, and it shows up at every stage of the patient journey and clinical care. So one of the key things is around making sure that the environment is very clean, right from the time patient come into pre-assessment, to admission, to theatre, to ward care, and also to being discharged and attending outpatient appointments. So the environment is very important, keeping it clean, because these microorganisms that causes infection, they are all over the place. We can see them with our eyes as we see, so they are quite tiny. They can only be seen under a microscopic examination. So the whole essence is to make sure that we are cleaning them, we can see them, they are germs, we want to make sure that we get rid of them from our hands, from equipment and the environment where we're caring for the patient. So it's quite important for the environment to be clean, and there's a whole loads of the infection control bundle around hand hygiene, cleaning, environmental safety, the structure, and antibiotics as well, making sure that patients are on the right antibiotics that suits their the kind of situation in which they are or that they are being treated for. And waste management is part of it, ensuring that we prevent sharp incidents, and lots and lots around education, supporting clinical staff, supporting non-clinical staffs in making sure that the patients have the best experience as one of the values of the RNOH.
How big is the team? Are you the team, or is there a wider team?
There is a wider team. There is the Director of Nursing, who is also the DIPSE. That's the Director of Infection Prevention and Control for the Trust. That's Paul Fish, is the Director of Nursing. He takes the whole sole responsibility for infection prevention and control, and I'm the lead nurse. And within the team, we have Christina, my colleague here. We have another staff member who does data collection, because we report all our infections to Public Health England and also to various committees within the trust. So at the moment, we have 4 people within the team. And we also have another infection control nurse. The post has been vacant for a while, but we've managed to recruit into that post. So there will be an infection control specialist nurse also in place in about 2 or 3 weeks from now.
Okay, let's move on now to the RNOH Hand Hygiene Week, which is something you're trying to get the message out there, I guess, as much as possible around the hospital. Can you tell me what's involved in over the coming days?
We will be having lots of activities being carried out from the 3rd to the 6th of May 2016. Hand hygiene is very important. It's one of the key measures of infection prevention and control, and we will be doing this in collaboration with the World Hand Hygiene Day, which is on the 5th of May. All hospitals locally within England and even outside of the United Kingdom, various places will be celebrating World Hand Hygiene Day. And the theme for this year, as set by the World Health Organization, is hand hygiene supports safe surgical care. And for us as an elective surgical hospital, it's quite important that we embrace this theme and that we work with it. So we really want to make sure that all our patients, staffs, relatives are aware of this important program coming up with lots and lots of activities. And it's all to make sure that we all understand the importance of hand hygiene in preventing infections. A couple of studies have shown that most healthcare associated infections are transmitted from one patient to another through the hands of healthcare workers, and that is not a nice thing really to hear. So the whole essence of this is to drive home the importance of hand hygiene amongst clinical staffs and amongst patients and staffs as well, because it goes both ways. Clinical staffs must make sure that their hands are clean at every point of care, before they care for their patients, after caring for their patients, after exposure to patient blood or body fluid, after exiting patient care environment, and even on entering patient care environment. They're expected to wash their hands bare below the elbow before approaching a patient or carrying out any care. And equally for patients as well, we expect them to remain tidy, nice and clean while in hospital, wash their hands before they eat, wash their hands after visiting the toilet, because they could pick up fecal-oral infections if they don't wash their hands.
Yeah, that's interesting, because I've always looked in terms of hygiene in hospitals almost aimed at the visitors, because when you visit someone in hospital, there's signs up everywhere, wash your hands, there's the little dispensers you get on each of the wards and everything. But clearly from what you're saying, there's a big emphasis on this within the hospital itself, with the patients and the staff that are caring for them?
Yes, everyone is involved because it's a closed loop. So everyone needs to do their part. Otherwise, we will not reduce infections. And the infection prevention control vision is that no one should be harmed with preventable infections. And that's why we do this lot of infection control bundles and a lot of focus around hand hygiene, both for patients, visitors, and staffs. Is very, very important.
So what have you got planned for the coming week? I know you've got different things happening on different days.
Yes, so starting with is the 3rd of May. For RNOH, it's the Learning at Work Day. So it's a day that is everyone is expected to come and learn something while at work. So that will be in Chaslak Teaching Center, and there will be different stalls for different departments, different things that people can learn. People will want to progress in their career, or other departments that they're not aware of what activities is going on there and how they are supporting patient care. So Infection Control will be having a stand at the Learning at Work Day on Tuesday the 3rd of May between 11 o'clock and 4 p.m. in the evening. So we'll be expecting that as many people as possible, visitors, patients who are able, and doctors, nurses, catering, domestic staffs, physiotherapists, radiologists, all categories of staffs to come and learn more about hand hygiene, the importance of it, and why we are placing emphasis on it as a key element of preventing infections. So moving on from that day, we'll have another stand on the 4th of May on the slope for everyone passing by to stop and also check their hands under the UV light box, because we have a machine there that if you try to do your hand hygiene technique using alcohol and gel, we can actually check whether you're following the correct process, because there is a process, there is a technique to use to make sure that every aspect of the hand is covered when you wash your hands or decontaminate with alcohol hand gel. And unless the whole hand is clean, any part of the hand where microorganisms is still being left or not washed out or cleaned using the alcohol hand gel can still serve as a means of transmitting microorganisms to patients or to other staffs. So it's quite important that people are aware of the hand hygiene, the correct hand hygiene technique, and taking that technique on board in their daily activities. So we'll be checking staffs and visitors, guiding them around the right technique to wash hands. So we'll be on the slope between 11 o'clock in the morning and 12:30, and we'll move on to outpatient department so that we can capture as many patients and visitors as possible between the hour of 12:30 and 1:30 at the RNOH main outpatient department.
Yeah, it's interesting you're using infrared inspection. I've seen them on the telly. You put your hands in that infrared and it just shows up the fact that you actually haven't cleaned your hands at all.
Yes, it does highlight.
So that's good work you're doing. Carry on.
Yeah,
What else is on the week?
So on the 5th of May, which is the big day, is the big World Hand Hygiene Day. The infection control team and the link nurses will be moving around theatres, wards and various departments. We will pitch our tents at some point for a couple of hours in theatre so that we can have a good time with our colleagues in theatre, the surgeons, the scrub nurses, the anaesthetists, ODPs, and everyone who works in theatre. They are all very important and they do an amazing job. They seems to be the experts really in hand washing because they scrub up on daily basis, but it will be another opportunity for them to actually reflect on their technique and be happy and feel comfortable with what they do, which is cleaning their hands before they care for their patients, which is very, very important. And just also in line with the theme of the year which was set by the World Health Organization, hand hygiene supports safe surgical care. So that's why we'll be spending a bit of more time in theatre on the 5th of May. And on the 6th of May, which is the last day, Friday, the 6th of May. We will be at the restaurant at Brockley between 12 o'clock and 2 p.m. in the afternoon, which is the lunch time. So hopefully to capture as many people as possible, to remind them to wash their hands before they go and order their food, and so that they are not enjoying their sandwich or their warm lunch with microorganisms, and wash their hands after eating as well. Along the week, there will be many other things going on, and flyers, posters, treats with sweets for anyone who visits the infection control store. Many staffs, clinical lead, charge nurses, physiotherapists, nurses and doctors will be in the hand hygiene t-shirts as well. We want to promote good practice around hand hygiene, and to say it's good to spread the word that clean hands saves lives. We should pass on that and not the germs.
You're listening to Brockley News on Radio Brockley, London's longest running hospital radio station, serving the Royal National Orthopaedic Hospital in Stanmore since 1966. Next tonight on Brockley News, we catch up on our series of alternative therapies from the Disability Foundation. Over now to Sue Weston.
My name's Sue Weston, and I'm here now with Ronit Broder from TDF, and we're going to talk about the monthly therapies that are going on, and also we're going to talk a bit about what TDF actually stands for. So, Ronit, could you just tell us a bit more about it?
Yes, of course. TDF is a charity organisation that is running the complementary therapy department at the Stanmore Orthopaedic Hospital. It's located at the back of the hospital in one of the little huts, and there's a host of complementary therapies available. You need to be a member, so you join as a membership, and you pay quite a nominal fee as a membership, and it's available to absolutely anyone, which is slightly different to what the actual name stands for, which is the Disability Foundation.
So what therapies do TDF provide?
Okay, I'm an acupuncturist, and we now offer acupuncture 4 days or 4 slots during the week. There's lots of different massage therapies going on, including Indian head massage and sports remedial massages, aromatherapy and osteopathy, reflexology, Reiki, hypnotherapy, craniosacral therapy, and there's also a chiropody which will be offered very shortly.
That's great. And it's at the back of the hospital, you say, up by the clock tower, isn't it?
That's right, yes.
And it's completely accessible for wheelchairs as well,
It is. There's a car park that's right outside, and now there's a lovely new banner at the front of the building to tell everyone where we are.
Oh, that's brilliant. And as you said, that it's these therapies are available for even patients in the hospital?
Absolutely, yes. We would be able to see patients who are outpatients of the hospital, their carers. It's pretty much open to the community as a whole.
It sounds absolutely fantastic. So it sounds like, this sort of treatment is really beneficial for people, especially people that are getting over an operation or treatment. How do they come to see you? What would be if I'm listening to this now, how would I come and find out where you are and how to book in and pay my fee, which is about £25, isn't it?
Yeah. Actually, there's a website, so if you go to www.tdf.org.uk, or you can telephone and they give you the information that you need, and the number is 0208 954 7373.
That's great. So now I'd like to find out a bit more about the treatment that you provide. So you're acupuncturist.
Yes.
And so how does that? What sort of things do you do, and how does that work?
How does it work? Okay. First of all, I just want to tell people that I studied at a university degree level. and part of the degree is that we learn as much about Western medicine as we do about Chinese medicine. And Chinese medicine dates back to over 2,000 years. It's a proven therapy, and there's lots of evidence-based studies that have been done to actually prove that acupuncture is helpful in many, many conditions.
And what does the treatment entail?
Okay, so acupuncture itself is inserting very, very fine needles into acupuncture points along the body. So you have, the Chinese believe that we have like an invisible meridian system all over the body. And if I can explain it in a much easier way, if you can visualize the tube map, and there's lots of different coloured lines, and you have tube stops, and you've got the beginning of the line and the end of the line, and tube stops all along the line. So each line represents a different organ.
Mm-hmm.
So for instance, the central line is the red line, it would represent the heart line, and the green line would be the liver line, and the lung would be the blue line, etc. We would access different points along that line, and every now and then there's a central station, and those central stations would access different lines, just like if you get to Victoria Station or St Pancras, and you can access different lines. So the analogy would be, if you had a headache and you came to me, it would mean that there's what we call stagnation, or something that's blocking the energy flow in that line, or in more than one line.
Mm-hmm.
So it's, again, going back to the analogy of the train and the
Yes.
station, it means that there's a train stuck somewhere in the tunnel.
Mm-hmm.
So what we do is, we wouldn't necessarily put a needle in your head to cure the headache, but we would go to the end of the line, so put a needle somewhere in your foot,
Mm-hmm.
and that will blow the energy
Yes.
and actually help move the train out
Yeah.
of the tunnel,
Yes.
thereby releasing the headache.
It sounds absolutely amazing. I have actually had treatment like this, and I've experienced like tingling down my legs and my arms, and I found it to be really, really therapeutic. I must say, really helped with the issue that I had.
It
Yeah.
is. It's actually a very gentle therapy, and it's very holistic. We look at the body, the mind, the spirit. We generally believe that if there is a dysfunction or a disharmony, that it's about what else is going on.
Right. Okay.
So we treat the whole of the person. It's not just where the pain is.
Yes. And they can come and have one-to-one sessions, can't they?
Yes, we have therapists there 3 days a week, and you can book in for a one-to-one session. And we've also started a seated acupuncture group, and it is exactly what it is. It means that you're in a room with some chairs around there, and you come, you sit down, the therapist comes to you and talks to you privately about your condition, and then we decide on a treatment protocol,
Mm-hmm.
and then we give you the treatment, and it's a very relaxing therapy. Very often you just actually nod off, or just find it very, very relaxing,
Yes.
and it's very helpful for, as I said, many, many conditions.
That's right. So that sounds really, really. It sounds interesting, and the group one sounds interesting too to me. So is it more cost effective to do it that way, or?
Well, it is. I mean, firstly, as a member of TDF, you actually make a suggested donation. So even if you were having a one-to-one treatment, it didn't really matter what it was. So if you were having massage or Reiki or whatever, there's there's a suggested donation, so you would give that, which is probably less than half the prices that you would be charged outside of this environment. The seated acupuncture is less expensive than the one-to-one sessions, so it's more affordable, and patients find it more suitable because they can drop in more often. Right. Because we deal with more than one patient. Yes. There's always availability for appointments.
That sounds great. I might be visiting you.
Well, I hope so. Looking forward to seeing you there.
So what sort of conditions would people have that you could help them with?
Well, there's a list, really, a huge list from A to Z. I'm a British Acupuncture Council member, so that's our governing body. And if you go onto their website, which is www.acupuncture.org.uk, and you go onto the list of conditions, you can click on each one of those and it will give you research-based evidence of how it works. But the list is endless. It's anything from anxiety to stress, pain management, fatigue, insomnia, gastrointestinal conditions, asthma, back pain, knee pain, which we see all the time, neurological conditions as well. So yes. It really does go across the board.
And also, so you mentioned anxiety. I'm just thinking now, when I've experienced it myself, and it was not frightening in any way to me in the end. But at the time, I was thinking, what is it going to be like? So, what would you say to people about having needles? Well,
firstly, I must explain that they're very, very fine needles. It's nothing like an ordinary needle that anyone would think about. They're almost hair-like, and sometimes you just don't even feel them going in. It's very, very gentle. Sometimes we do stimulate the points so that you can feel a tingling or an ache or some kind of moving sensation in the body. And mostly I find that it's the men who are more wary of acupuncture, and actually once they've had it, I didn't know what I was worried about,
Yes.
And the benefit has really outweighed, their anxiety. So it's a very gentle treatment, and actually it's incredibly relaxing.
Lovely. So if you're listening to this now and you'd like to get in touch, I'll just give you the phone number again, which is 020 8954 7373. And the website to look up anything you want to know as well is www.tdf.org.uk. And I've been speaking to Ronit Broder. Thank you very much for your time.
Thank you very
I look
much.
forward to seeing you soon.
Thanks a lot.
Now, thanks to Sue Weston and Ronit Broder. Stay tuned to Radio Brockley now for Bedside Bingo with Dave Rauch, your chance to win some Radio Brockley goodies. And do join us at 7 p.m. next Sunday for another Brockley News.